Can exercise really treat depression? Or is it just something people say when you go to the health food store or the local gym? Let's find out. Hi, I'm Dr. B. In today's video, I'm going to dive into this question in detail. First, we'll look at the scientific evidence based on peer-reviewed research, and then, because all research is not created equal, I'm going to explain why I think this data is so promising. Because if you're looking for a natural way to treat depression, exercise might be the ticket. It's low risk, it's accessible, and it's an intervention that can be used even if you're already on antidepressants or using cognitive behavioral therapy. The evidence to support this comes from a powerful study performed in Norway. This is known as the Hunt cohort study, and it was published in the American Journal of Psychiatry. In this study, researchers evaluated 33,000 adults and then followed them for over 11 years. They looked at all 33,000 individuals and carefully screened them. They looked for any history of depression or the presence of any active depression. Then the researchers followed them for 11 years, keeping track of their exercise habits, looking at how much exercise, how often, and what kind of exercise they perform. The researchers then followed this enormous group to see who developed depression, and they compared the rates of depression in those who exercised with those who didn't exercise. And they looked at the type of exercise, the intensity, as well as the age of the individuals and whether patients were male or female. The results were fascinating. Those that exercised just a little over an hour a week had a 44% reduction of their odds of developing depression. So in another way to say this would correspond to eliminating 12% of cases of depression if all adults exercise just a little over an hour per week. Wow! What are the real-world implications? Well, in the United States, 17 million people suffer from depression per year, and worldwide, 300 million. So that means in the United States, each year, with simple exercise, as many as 2 million people might be helped with their depression. And worldwide, as many as 36 million individuals could be helped, again with a little more than an hour exercise per week. And most interestingly, this protective effect was seen equally across all groups. Regardless of the intensity of the exercise, regardless of the gender of the participants or the age of the participants, the exercise worked the same. So this is a fascinating study with fascinating results, but there's been lots of studies on exercise, and why do I think this study is so relevant and so important from a scientific and medical basis? Well, the results are particularly valuable for a number of reasons. Firstly, it's based on a very large population, 33,000 participants. This means that when you have a sample size this large, the effects you find are very likely to apply to the general population. Whereas when you look at smaller studies, 100 people or even 1,000, those types of studies may not apply to everyone because the findings may be just from random chance or other biases. Secondly, this study has a long period of follow-up, 11 years. This means that researchers tracked and observed the participants over a very significant time period. This is vital in something such as depression because it's a chronic condition. It can take many years to develop, and studies with shorter follow-up periods are very likely to miss cases that might occur later in life and will be much less accurate. Thirdly, the study is prospective in nature. This means that the researchers observe the participants before they develop depression, and they track their exercise and depression over time. This allows for a more accurate assessment of the relationship between exercise and depression because it eliminates something known as reverse causality. Reverse causality would mean somebody who was depressed is very unlikely to exercise, or they exercise less. So if you didn't identify that ahead of time, the study wouldn't be accurate. And finally, and perhaps most important, this study found a very large effect size, a 44% reduction in the odds of an individual developing depression if you exercise for just 1 hour a week. Again, this could help 2 million people in the United States, 36 million people worldwide. Even with a small amount of exercise, a little over an hour, what a remarkable effect on preventing depression. That's exercise and depression. Thanks for watching. If you found this interesting, try these additional videos on broccoli and depression, and here's an easy brain hack for anxiety. And if you have other ideas you'd like me to explore, leave them in the comments below. And please don't forget to hit subscribe.